Good evening to all the viewers who are watching live and will be watching on a recorded version. Before starting this CME, let me just guide you with this. Let me just tell you one thing that we will be continuing with our Spotify thing, which you will getting on the which you will get the link, the playlist link on the description, and we will talk about that more on later. But but we will resume uploading over there from next Sunday. So stay tuned and more about that on the end of this CME. So without wasting any more time, let's just start our today's CME with the 30 seconds countdown time.
Good evening, everybody. Good evening, sir.
Good evening.
Sir, after studying one by one, we are now on the 57th episode. It's a proud moment for NIH Alumni Association, and the only association in the medical science so far. We are getting reviews from various aspects who are continuing on trying to build up all the alumni across the globe in under one platform. And sir, you please say a few words before we call our inaugurator tonight.
Welcome to everybody. Definitely, all of us are encouraged by getting our new brilliant speakers. So, without wasting time, let us start the seminar.
Right, sir. And on this 57th episode of our CME, we have our inaugurator tonight is Dr. Javeed Iqbal Dar, who is a senior medical officer from government of Kashmir. And another very good information tonight is that we are having the speakers, moderators, and inaugurators, all our PG alumni. Tonight's session is all PG alumni of NIH. So we hope it will be a very excellent session. I'll request Orko, our backstage editor, to bring on Dr. Javeed Iqbal Dar on the screen.
Thank you, sir. Good evening, all of you. It's my honor to be the inaugurator of the seminar. This is the first time that I am joining with the NIH alumni. So very thankful to all to the faculty of this NIH alumni that they had given me the chance to be the inaugurator of the seminar. I hope everybody is listening to me. I am Dr. Javeed Iqbal from Kashmir. I am 16th batch PGT from NIH Kolkata. I am working as a senior medical officer at government district hospital Handwara, that is in Kupwara district. So I belong to the north end of the country. So this is good thing that we have this seminar is going to be the national. So we are so many people that are joining us at the national level. Today's seminar is something special because it's a practical one. Both the things that are needed in our day-to-day practice that have been taken care of in this CME. First of all, the diabetes mellitus, type 2 diabetes mellitus. That is the epidemic. That is a coming epidemic for the India because of our lifestyle and all the things. And I hope homeopathy will be doing a great job in this, because all we need is a constitutional treatment for this disease. And we are hopeful that today's seminar will be putting light on that, how to diagnose, how to get constitutional remedies for the particular patients. And second speaker, that's Dr. Soumya Bhattacharya ji. Dr. Abishes Saha, sir. He will be talking on the OPD in Delhi, challenges and scope. That's also a practical topic that will be dealing with the patients, different challenges, and scope for the homeopathy in Delhi. So before handing mic to the today's moderator, I would like to announce the winners of the quiz competition that has took place in the recent past. First winner, sorry, first position holder is Shivani Datta. She has answered the question in 23.5 seconds. And second is Surbi in that particular quiz, and she has answered the particular question in 50.2 seconds. So congratulations to the both of these who are winners, and I hope in future we are getting more and more people to be joining this quiz competition. So I won't take much of your time because time is precious, time is money, time is everything. So let me hand over my mic, or let me hand over the proceedings to the today's moderator, Dr. Soumya Bhattacharya ji, who is a lecturer, Materia Medica D&A, Homeopathic Medical College, Kolkata. Please, sir, continue with your moderates.
Thank you, Dr. Dar. Uh, Good evening to everybody. I thank every member of the Alumni Association of NIH for inviting me to moderate this session, having such distinguished speakers and such distinguished audience, my brothers, sisters, my teachers, everyone. So, without wasting the time, let us continue to the seminar. Two important topics are in today's list. First of all, approach to type 2 diabetes mellitus by Dr. Pulakendu Bhattacharya, who is a lecturer of the Department of Organon of Medicine, DND Homeopathic Medical College and Hospital. He is also an ex PG alumni of NIH, who will speak today about homeopathic approach of diabetes mellitus. And in the second session, we are having Dr. Abishes Saha, Director Ayush, Government of Delhi, who is an honorable speaker today. I hope by these seminars we will get some take-home message, and this seminars, as it is the 57th session, is still continue to unite the homeopathy which was taught to the students who are now alumni and spread to the north, south, east, and west of India, meet again and share their views so as to enrich the homeopathy and homeopathic literature and knowledge. Without wasting time, I would like to call upon first on screen Dr. Pulakendu Bhattacharya and request him to continue with his seminar topic.
Sir, please start.
অর্ক আমার স্ক্রিনটা পুরোটা দেখা যাচ্ছে না তো। ওকে, screen please. Good evening everybody, respected teachers, my seniors, my juniors who are present over here. I am Dr. Pulakendu Bhattacharya, lecturer, Department of Organon, TND Homeopathic Medical College Hospital, and 13 batch PGT of NIH. Today I am presenting the topic homeopathic approach to the treatment of type 2 diabetes mellitus. Diabetes mellitus is a well-known disease to the worldwide population. We all know that, and the term of diabetes was first coined probably 250 BC before Christ. From time to time, human being face to this disease, and treat it or manage it to their own way. But one line or one comment we have been hearing many a times, that a patient, if once diabetic, is ever diabetic. Is it true or not? Today, I want to focus on this area with the approach of homeopathic approach to the treatment of diabetic mellitus. First, in the beginning, let's have a look on the key facts of World Health Organization recently published. Among these key facts, one thing I want to mention here, that the prevalence has been rising more rapidly in low and middle income countries than in high income countries. It is a significant point. Another thing is that between 2000 and 2019, there was a 3% increase in diabetes mellitus rates by age. And also, to manage it, diabetes, a healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use are ways to prevent the delay or onset of type 2 diabetes mellitus. That means not only the medicines, other lifestyle changes, diet and regimen should be followed along with the medicine. World Health Organization describe it or mention it in their key facts recently 16 September 2022. First, I want to share a few cases, as because I think it is a practical approach. So I want to show some cases how the patient presents themselves along with the diabetes in a different ways. First case here, I want to share a male aged about 45 years, a serviceman. Firstly, his colleague noticed that he significantly losing his weights, and he noticed that he lose at actually 5 kilo weight within last 1 month. He rushed to the physician, and the diagnosis told him that he has been suffering from type 2 diabetes mellitus, where random blood sugar level was more than 500 milligram per dl. Along with that, he was mild hypertensive. His presenting complaints were severe weakness, frequent urination, hyperacidity, and flatulency. And these complaints started only for last 1 week. That means it is newly onset diabetes mellitus. His one parent, that is father, is diabetic. He has no addiction, and but one thing is significant, that for last few months he has been passing through a stressful condition due to his family issue, very stressful condition. It is a one kind of presentation from a patient. Next, another patient, female housewife, 46 years old. He has been suffering from diabetes mellitus for more than 7 years. Along with that, other comorbidities like hypertension, hypothyroid, even rheumatoid arthritis. Actually, patient came to us to treat his joint pain, her joint pain, and he has been used to take allopathic medicine for a long time, but for last 6 months, his own opinion, she stopped all the medicines. In a family, we have found that her mother and grandmother also suffered from diabetes, hypertension, hypothyroid. His PP, that means postprandial blood sugar level, was 295 milligram per dl, and she was also a non-obese patient, complaining of multiple joint pain. Another presentation, another case. He was a farmer, 55 years of age, suffering from type 2 diabetes mellitus and hypertension for more than last 5 years, and he used to take medications for that, and even still when he was came to us, uh, he was taking allopathic medicines for both the conditions. complaining of headache, nausea, vomiting, and loose stool for last few days. That is an acute presentation, acute manifestations of few symptoms like headache, nausea, vomiting, and loose stool. Along with that, he was suffering from pain in left shoulder joint. That is due to frozen shoulder. Single parent was diabetic, and he also a non-obese patient. His postprandial blood sugar level was 218 milligram per dl. This is the third case. Now fourth, it is another kind of presentation where a businessman, middle-aged, 42 years old, suddenly accidentally diagnosed as pre-diabetic. He tested his blood for to clear his doubt regarding his health and suddenly found that his fasting blood sugar level is 120 milligram per dl. That is, it is in pre-diabetic range. He is obese. He came to us for his few complaints like hyperacidity, sleeplessness for last few weeks, and a significant past history was there, recent past. That is, he has been suffering from ILI, influenza-like illness, for 1 month ago. And his both parent was non-diabetic. These four types of presentation, actually, four people are suffering from diabetes, but their causation, their presentation are different. Now, now we have to look at the disease, that is disease proper, that means type 2 diabetes mellitus at a glance. Diabetes mellitus is a clinical syndrome characterized by an increase in plasma blood glucose level. We all know that. One key word is there in the pathology of diabetes, which is insulin resistance. In type 2 diabetes mellitus, resistance to action of insulin and inability to produce sufficient insulin to overcome the insulin resistance, actually it is the key mechanism of production of type 2 diabetes mellitus. And sometimes this insulin resistance is a cluster conditions along with comorbidities like hypertension, dyslipidemia, non-alcoholic fatty liver, PCOS, like that. And modern medicine told that primary cause is unclear. Central obesity, lack of exercise are the potent cause of insulin resistance. They imagined it. Here a picture, graphical presentation, pictorial presentation diagram, where we have seen that a normal condition deranged to insulin resistance, what I have already told, and preliminary insulin resistance, then decreased insulin secretion, because islets of Langerhans cannot manage to produce more insulin. Finally, ultimately, decreased secretion of insulin has been happened, and type 2 diabetes mellitus is produced. Along with that, this mechanism, susceptibility loci, that means genetic susceptibility and lifestyle lifestyle modifications changes, also responsible, even some vitamins also responsible for these mechanisms. We all know that. Another thing I want to mention here from the modern medicine, there is a natural history of diabetes, where we have found that in normal condition, plasma glucose and plasma insulin level is remain in a balanced condition. But those patients are prone to diabetic or going to be a diabetic patient, their plasma insulin level primarily increases to a huge range, but his or her plasma glucose level remain in a static condition. That means presentation, what that is plasma glucose, we are more concerned about that is plasma glucose level. It is not primarily increased. Primarily plasma insulin is increased, and after that, when it is decreasing to a certain level, then the plasma glucose level start to increase. That means presentation of symptom, presentation of uh, blood parameter come later before the bodily derangement of or plasma insulin regulation have been hampered previously before the onset of plasma increasing plasma glucose level. And when the plasma glucose level raised start to raise, that means then the plasma insulin level is falling, and this condition is we are calling it impaired glucose tolerance or pre-diabetic condition. Then come to the frank diabetes or type 2 diabetes, whatever you may call. These are the normal values. Better to follow the HbA1c level, but in all areas or all clinics, all hospitals, this test is not available. So finally, we can rely on PP and fasting blood sugar. But HbA1c test is more significant than these two, and these are the normal range. We all know that. But one thing what Davidson Clinical Medicine is mentioning, that in both the common type of diabetes, environmental factors interact with the genetic susceptibility to determine which people develop the clinical syndrome. That means you have the susceptible gene, you may expose to the environmental factor, but finally who develop the clinical syndrome, it not dependent uh, only for these two factors, conjointly two factors, or maybe there may be some other factors. Actually pathology is unknown. They declare that actual pathology is unknown. Clinical manifestation of diabetes, it's separate thing. You may have tendency, you may have you have exposed to environmental factor. That doesn't mean you will be a diabetic patient. Here remains a current genetic and epigenetic insight to the type 2 diabetes mellitus, published in peer-reviewed journal, where one thing I want to mention, uh, it is a complex metabolic disorder where both genetic and environmental factor contribute the pathogenesis. And another thing which is more interesting is that evidence suggests that environmental factors can easily influence these epigenetic markers and increase the risk of type 2 diabetes by affecting gene expression. That means finally gene expression is important. Additionally, it is suspected that variable drug response, it is more important. Variable drug response in patient with type 2 diabetes mellitus is due to different level of type 2 diabetes associated gene expression. Thus, exploration in the pharmacogenetic and the epigenetic aspect of type 2 diabetes mellitus is needed toward personalized medicine, personalized treatment. Who told it? The research of modern medicine told that to combat diabetes mellitus, we need a personalized treatment. Though their personalized attitude or our personalized attitude is not the same. I'm not telling that, but they are also looking toward that personalized treatment. Where, as because the treatment response, drug response is varying from person to person with type 2 diabetes mellitus. Is there another evidence where genetic and epigenetic research on type 2 diabetes mellitus is indicating that international collaboration and large-scale meta-analysis of genome-wide association study have made this achievement possible. However, whether the identified common variants are causal is largely unknown. Why some people have these gene expression and why some people have not this gene expression with having this susceptible gene loci or these environmental factor, it is completely unknown. Now, view as a homeopath. We all know that type 2 diabetes mellitus will be classified as true natural chronic disease. How it is formed, how miasmatic chronic disease is formed, actually in the latent miasmatic state, when some trigger factor what uh, Hahnemann called these as occasions act along with the accompanying modalities, that is circumstantial factors. These two, that means occasions or trigger factors and accompanying modalities, those are the different thing, not the same thing. Trigger factor work according to the accompanying modalities on the latent miasmatic state and manifest various manifestations of secondary stage of miasm. Varieties of symptom comes from latent miasmatic state due to two factors. One is occasions or trigger factor, another is accessory circumstances. And among the trigger factors, Hahnemann mentioned grief, vexation, and exhalation from swamp are the most potent occasions or trigger factor for develop a secondary miasmatic state. In our organon, in the appendix, we have found regarding diabetes, few lines have been written. If one kind of diabetes was curable by ammonium sulfate, many other kind were not benefited by the remedy. That means what in genetic research we have seen that drug variation, drug action on different have been different on different peoples. Hahnemann also in the organon introduction portion or appendix portion here also mentioned that if one kind of diabetes was curable by ammonium sulfate, many other kinds were not benefited by this remedy. Alum seemed to be the best medicine for a few cases, whereas the others neither alum nor sulfate did good. That means individualization is needed and individualized medicine will be prescribed. And this diabetes is not the general diabetes. That means a person is suffering from diabetes, kind of diabetes, what has been written here, but not simply diabetes, so as to convey the false impression that they are all one simple identical disease. That means they are not 5, 10 persons suffering from diabetes. They are not one kind of diabetes. They are different kinds suffering from different kind of diabetes, not the same kind of identical disease. An understanding of manifestation of type 2 diabetes meters from miasmatic aspect. Miasmatic actually manifestations. Understanding of manifestations from miasmatic aspect. Here I have mentioned few symptoms from different sections, that is mind, in sensation and complaint in general, modalities, and few head, eye, vision. That is those parts are mostly affected with diabetes mellitus. I am not detailing that. We all know that sodic patient is quick, active, anxious. Syphilitic patient is stupid, dull, stubborn, depressed, forgetful. Psychosis patient forgetful but recollection of recent event difficult. We all know that. And in sensation and complaint, few general symptoms are there. That means sodic patient will be there will be dryness, burning heat, sensation described as if mental symptom improved if physical symptom develop. Chilly patient, unnatural hunger. Syphilitic patient, profuse sweating which aggravate the complaint. Hot patient, pain in the periosteal part. And psychotic patient, affection in single part, partial sweating affected by both chill and heat, lameness and stiffness of joint. There are many symptoms and their classification according to their miasm. We already know that. Special few symptoms are the characteristic for differentiating the miasms. Like that, modalities. Modality is also important thing, which can differentiate different symptom in under different miasm. That means sodic patient aggravation standing, motion, cold, mental excitement like that. Syphilitic patient aggravation at night, heat, natural discharge. Psychotic patient aggravation rest by initial motion, early morning, during the day, in damp weather, etc. And there are few particular symptoms regarding particular parts. I am not detailing it. Now, the understanding of pathology of type 2 DM from miasmatic aspect. Pathology of type 2 DM. Basically, we know that SORA is a functional disorder only, syphilis is destruction, deformity, and psychosis is overgrowth in coordination. In the perspective of diabetes mellitus, if we find that insulin resistant state or incoordination in the body, we may call it as a psychosis. If a patient uh, becomes diabetic after a stressful situation and he have only some functional symptoms, not any changes in the deep organ tissue, no other complication like that, then we call it as a psoric patient or psoric diabetes. But few stalwarts express their opinion in their own way and with few justifications. Dr. J. H. Allen, he told that diabetic patients are as a rule strongly tubercular. You will find the tubercular physiology throughout them, with the diathesis strongly marked. If psychosis be present, these cases are of course more malignant in their nature and more fatal. We all know. That means generally tubercular, and if psychosis present, it is more incurable. And regarding this pathology, what Hahnemann told that most significant point in the whole history of chronic disease, it is also more important. That means since birth, patients suffering from different type of diseases, and many of the diseases sometimes indicate one line of pathology. Pathology means dynamic pathology, and that is it may be psoric, may be syphilitic, or may be psychotic. By these points, we also classify the miasm of diabetes also. Next, nature of manifestation. This will also help for individualization as well as miasmatic classification. Some patients present their symptom more suddenly, violently, and their common symptoms are more prominent. This patient comes after a stressful situation. We may call this, classify this as a psoric. Few patients are there, come to us, and their complications arise quickly, very early stage. Within few years, they suffer from violent complications like uh, retinal, eye, or kidney, neurological, nephrological, like that. These patients may be syphilitic, maybe. Or third, in the third point, some patients are having no manifestation or insidious onset of hyperglycemia. That means patient come, their blood glucose level is high, but they have no manifestation. These may be classified as psychotic. There may be combination of manifestations. Already I have told that in the time of insulin resistance, many comorbidities with attached to diabetes mellitus, like hypertension, hypothyroid, joint pain, rheumatism, rheumatic arthritis, like that, and rheumatoid arthritis. Some symptoms also peculiarly we have been found associated with diabetes mellitus. Few examples I have taken from different repertories. Many more are there, but I have taken few. Uh, Diabetes mellitus, boil successive with natrum phos, we all know, mentioned in Phatak repertory. Diabetes mellitus, lung affection with calcaria phos, it is also mentioned in Phatak repertory. Blood anemia in diabetes, that means blood anemia and diabetes are related, that is podophyllum. Back, spinal cord inflammation, myelitis with diabetes, phosphoric acid, mentioned in NAR repertory. Back pain with lame feeling in the diabetes, Helonius. These all are mentioned in NAR repertory. One case or a drug, Dr. Lilienthal also mentioned diabetes mellitus with different clinical condition, that means bronchial irritation, that means respiratory problem, sighing respiration, cardiac depression, that means cardiovascular diseases, and some neurological central nervous system complications. This drug is Lycopas virginica. This I have taken is for an example. Many more examples are there. Another point, it is also an important point. Aphorism 225. When we have studied the mental diseases type 4, that is psychosomatic disorders, in mentioned in aphorism 225, where corporeal diseases arising from emotional causes, it is also an important for diabetes also. We have know that stress is a common factor or more strong risk factor for diabetes mellitus. Few examples, few rubrics from different Kent repertory from different emotion. That means grief elements from elements after anger with anxiety, elements after anger, vexation, etc. Elements after anger with fright, elements after anger with indignation, like that. These are I'm mentioning not to choose an only basis only the single rubric. It will be helpful to select a medicine along with the totality. Without totality, we shall not prescribe any medicine. And here, if we see that few medicines are repeatedly coming in the emotional stress factor which produce the corporeal diseases, that means ailment from emotional causes, few drugs like ignacia, lachesis, like staphyagria, like nux vomica, colocynth, like that. Now come to the point of management. Management in general, under general management, diet and lifestyle change is the prime target of us. Diet and lifestyle change also should we follow the individualistic approach. That means instruction for following the diet or making the diet chart for only for that patient in individualistic manner, and lifestyle change also that. All the patient not need for same kind of physical activity, and all the patient need not to avoid same thing for his diet. Here are a few examples are given here. Many more examples are also mentioned in different books. Now, medicinal management. Medicinal management may be two types. One is curative and another is palliative. Mainly, we focus on curative purpose. In curative medicine, curative approach should follow the totality of symptom considering strict individuality and predominant miasmatic condition. Only one thing is enough for curative approach. Here I have mentioned a case from Ibinas where rheumatic complication with diabetes mellitus and other symptoms, that means thirst, voracious hunger, profuse urine, many symptoms are there, and Dr. Nash was prescribed lactic acid and patient was cured. He claimed that patient was cured after this medication. Dr. J.T. Kent also mentioned in a few instances that he has cured diabetes. Cured diabetes. That means cured means in its whole extent. It not appeared or other symptoms of the patient not appear frequently. One medicine is acetic acid, another argentum metallicum. Many more medicines are there, details are there, but I am focusing on the approach only. In acetic acid, Dr. Kent has written that it has cured diabetes with sugar in the urine or without, where there is great thirst, weakness and pallor, and loss of flesh. Combination of symptoms. Another in Argentum Met, mentioning the constitutional term constitution. Catarrhal inflammation of the mucous membrane of the urinary passage, the whole urinary tract. It cures albuminuria, it cures diabetes with sugar in urine, and many of the broken down condition of the kidney, low broken down constitutions, enormous quantity of whey-like urine. Another for creosote. In first line, he told the marked feature of the creosote constitution is that when the desire to urinate comes, he must hurry or the urine will escape. That is, in these cases, they focuses on the particular symptoms with their detailing and considering the constitution of the patient also. Last line, generalize the symptoms given and you will see what kind of a diabetic patient will need creosote. Kind of a diabetic patient. Not all diabetic patients are the same. Now come to the point of palliation. Sometimes we need the palliative approach. What Dr. J.H. Allen mentioned in chronic miasm, that cases of incurable diseases, when we have sure that the case is incurable, then the curative approach can do the harm the patient. When the miasmatic action has progressed so far that no permanent reaction can be solicited, that means vitality is not sufficient to react the curative remedy, and any attempt to make a positive cure result the injury to the patient. Be cautious about that. Frequently seen in such diseases as in diabetes mellitus, it is well not to base our prescription upon the basic miasmatic symptom, better to palliate the disease by remedies not based fully upon miasmatic symptom. That means constitutional treatment is not needed here, but one thing is needed for prescription is the symptom similarity. We cannot deviate from that. An example from hearing clear and frequent urine with digging, crampy pain in kidney, shooting to stomach, dry mouth, great thirst, especially evening and at night, sugar in urine with great emaciation, diabetes acute case. Curer, medicine is curer. Now, I have come back to the answer of the first case, first model case. I have given example previously. The patient, serviceman, middle-aged, after a stressful situation, came to us with a anxiety, fear, and presenting complaint violently. This situation signifies us that the patient is soric, and the chances of curing of this patient is much more than the other presentation. From symptom similarity and miasmatic perspective, first of all, we have prescribed him the staphysagria, especially giving emphasis on his cause, emotional cause. Then, lastly, he have taken sulfur, and for 12 month during 12-month follow up, no aggravation of symptoms or pathological rise of blood glucose level happen. I am not telling that it is cure, but patient is doing well without any new symptom, without any aggravation, or without any pathological aggravation of pathological or symptomatological marker. Next case, where a lady previously taking allopathic medication, leave it before 6 months, now not taking any allopathic medication, in his own opinion, came to us, and she has been suffering from rheumatoid arthritis, shifting nature of pain, and as a whole, patient was a pulsatilla patient, predominantly psychotic, and we have the patient is still now under our treatment. Blood glucose is continually decreasing. Now it is below 200, and symptoms, along with the pathological markers, symptoms also improved. Now she has no pain at all. She has a diagnosed case of rheumatoid arthritis. Here also, I am telling that it is not cure, but I can tell you that probably he will be better in near future. His other pathological level also, along with the glucose parameter, will also be decreased. Next case, where patient still continuing allopathic medication, middle-aged man, come with a acute condition for treating. He was not coming to treat his diabetes mellitus. He was came to us to treat the acute nausea, vomiting, headache, like that. And after acute medication, he was prescribed thyroidinum and other medicines also prescribed. 8-month continue follow-up, but his sugar level decreased more than previously, but he is actually not doing well. Many a times his acute episode of symptoms, that is GI complaints, sometimes headache appeared, and we are treating in a zigzag manner. Actually, the curability of the patient is less than the two previous examples. And it is a more challenging part as because patient also taking allopathic medication for a long time, more than 5 years. Fourth case, it is a pre-diabetic after acute disease. That means maybe probable cause is influenza-like illness, and he was, along with the restriction of diet and regimen, we have advised to take medicine as because his pre-diabetic condition, that means symptoms and pathological level is changed immediately after acute disease. Complete his constitutional treatment, we have prescribed him sulfur, and patient is now doing good with his normal normoglycemic level, blood glucose level, normoglycemic level. Now, aim of homeopathic treatment. What we expect from homeopathy for diabetes mellitus, type 2, especially type 2 diabetes mellitus. First, can assess curability of the patient. Not only consider the blood glucose level. From the second slide, I'm trying to tell you that blood glucose level is not the ultimate parameter for us for individualized treatment. Treat new onset, that is new onset diabetes mellitus, who not started allopathic medication, and patient already suffering but not taking allopathic medication in his own accord. Try to treat with curable approach of this patient. Their curability will be high as because allopathic medication is not be administered. Maybe or may not be, but it is a possibility. Treat incurable or complicated cases, terminal stages, or not in terminal stage, but curability is less, one-sided presentation. These patients may be sometimes treated with palliative manner, but palliation should be in similar way, following similar principle. Patients suffering for a long time and remain under allopathic medication, start with homeopathic medicine, and we always want to taper the allopathic medicine gradually, not by the direction of us, but with consultation of appropriate competent authority. That means who prescribe that kind of medicines. In concluding part, type 2 diabetes mellitus is a chronic disease as per the disease classification of our master Hahnemann. But beforehand, we should consider the disease individual as a whole for homeopathic treatment. Like other chronic diseases, it will be managed with proper anti-miasmatic treatment. Similar medicines should be chosen following totality of symptom and considering predominant miasmatic state. Sometimes probable trigger factors along with their manifestation can take a lead role in the selection of the simillimum at the beginning of the treatment. Beside the curative approach, sometimes we need palliative approach in few instances, but it should also done with the similar medicine. Along with the law of similia, law of simplex and law of minimum should also be followed. But similar medicine, I have chosen medicine in similar way, but I am giving it in a physiological dose. I am not aware about the doses, what will be the adverse effect, adverse event after that, but I am prescribing. It should not be done, it should not be encouraged. Finally, patient's desire, it is also important. I will be better. These thought also remain in the patients. Finally, patients desire his zeal for curing and physician's true knowledge of cure. It is also important. Physician's true knowledge of cure ultimately help to achieve the true treatment goal of for type 2 diabetes mellitus. Thank you. Thank you all for patience hearing. And I am also thankful to NIH Alumni Association for giving me the opportunity for this seminar. Thank you.
Thank you, Dr. Pulakendu, for a very nice presentation, very informative, putting in the line the modern medicinal concept of modern medicine and our classical concept of homeopathy, miasmatics, showing us the scope of homeopathy, how to approach different kind of cases of diabetes. Thank you. It was very informative, and we got a take-home message from the presentation of Dr. Pulokendu that, in short, it should be that if we are to cure diabetes, yeah, there is no curative promise in diabetes as per modern medicine is concerned, but going further one step more, Hahnemann showed us 250 years or more back that there is only one way with which at least we can try to cure or we can try to palliate justifiably. That is the way he shown in his organon, his other works, and later followed up by different stalwarts like Herring, Kent, etc. I hope the audiences were greatly benefited by what Dr. Pulokendu said, and it will encourage in them the practices of classical homeopathy, the learning of classical homeopathy, its ways, even in concerning the disease, a burning issue like diabetes in today's society, in such disease also. With no further delay, we will progress to our next session. The speaker of this session is Dr. Abishes Saha, who is working as a Chief Medical Officer in Directorate of Ayush, New Delhi. I'll welcome him to be on the screen and continue with this seminar. The topic is OPDs in Delhi, its challenges.
Sir, continue. Sir, unmute, sir.
I want to start my slides. Can you help me with that? Okay, thank you. So, today's topic of CME is homeopathy OPD in Delhi, challenges and scope. First of all, a very good evening to all the respected panelists and listeners. Myself, Dr. Abishes Saha, 5th batch PG from NIH, and currently I am CMO in Directorate of Ayush, Government of Delhi. I want to sincerely thank NIH Alumni Association to give me this opportunity to present this topic, and special thanks to Dr. Bidyut Mukherjee, our Bidyutta, who from the very beginning of his student life is a very good leader and coordinator, and this is being continued till today. Before coming to the OPD scenario, I would like to mention about challenges to homeopathy in general. So, challenge in general. Probably homeopathy is such a field where sometimes patients are more positive than doctor. Let us discuss the general background. In last few decades, society has changed a lot. Pressure of being settled early in life has become a priority. Campus interview in engineering and similar other career options has given a concept of starting career in young age like around 20 to 23 years. When some young people starts earning at this age, those who are still in college feel low and depressed as it creates huge pressure. But on the other side, picture is not so flowery. Every field is challenging and most are time taking. Around 40 to 50% engineers are unemployed or underpaid. Only those from famous private or government institute are in comfortable position. In profession like law, business, medical, research field, BA, BSc, BCom, graduates, even MBA, students face stability. and it may take long time to get established. Some courses, though, give better opportunity, offers low income. In every field, people are working hard for survival. Getting a seat in your most favorite course or institution is too tough. Similar challenges exist in homeopathy. We need to see homeopathy in overall scenario, understand its scope and limitation in open mind. So the most important challenge to me about homeopathy is negative mindset or negative attitude about homeopathy. If a student have orientation and positive attitude from the very beginning, he or she may be prepared to find his or her way to get guidance from different successful practitioners, service holders, seniors, teachers. There are many successful homeopathic practitioners. That's how homeopathy kept its footprint in society. We are all aware about trouble of being established, trouble of being successful, trouble of being confident, trouble in our education system from school level to make our students ready and confident for their future endeavors. Sometimes we are lucky, sometimes we fail. Still, many of us were focused, got guidance, worked hard, passed through various troubles, succeeded, and leading a decent life. So, the baseline is if we accept and agree to go ahead with our existing situation, and if our concern is to find the way to get out of trouble, to improve, to uplift, we should identify challenges in our situation and to turn those challenges into opportunities. I feel very sad when in group discussion many homeopaths are blaming homeopathy always, are doubtful about effectiveness of homeopathy. Difficulty is there, but many times few homeopaths blame homeopathy to hide their own incapability and negative attitude. We need to develop skill set to make ourselves ready. Being established is not an easy job in any profession. Many dedicated homeopathy loving people tried their level best to convince government authority that homeopathy works. And as a result, many prestigious colleges in all over India, including NIH, various graduate and postgraduate courses, CCRH, ample number of government posts, free OPDs, huge monetary sanctions become a reality. That day, Dr. Kalyani sir was saying that during their student life, there were no such government posts for homeopathic doctors. Even in 90s, when we were students, there were not so many. But things improved, and it could only be improved further if the message is loud and clear. Homeopathy works. So, the question in general to the student and specially to Delhi. In Delhi, scenario is early establishment is a necessity as per surroundings. So, I think the first priority should be to decide and decide early. Either accept or leave. There should be no regret. Those students, either by choice or compulsion, decide to accept his situation with positive attitude towards homeopathy early in life and identify challenges and work towards it would be in better position to succeed. You may have noticed that many academically average students did well in their homeopathy career in comparison to students who were academically better. Most probably, the cause is they accepted their situation early in their student life, decided what to do, and started working hard towards it much earlier than others. Frequently, we start private practice immediately after getting the degree, without any preparation or with minimal preparation. A big and important thing is missed. You are in business. Only theoretical knowledge or degree is not sufficient to start a professional career. Most people are not ready when they start clinical practice. We should see this from perspective of patient. Patients are not aware of your degree or knowledge or miasm or single medicine or complex medicine or biochemic or mother tincture. They only want results and compare your clinic with all other available options. So management of clinic in terms of location, setup, investment is necessary. This is a whole chapter. There should be considerable work on it. We must adapt society's changing society scenario. We need to come out from shell. Exposure is a big thing. From personal experience, I can say exposure in environment of NIH during PG is obviously more enriching than UG days in my Mohesh Bhattacharya Homoeopathic Medical College. And exposure in environment of Delhi as a medical officer is higher level of enrichment. So, question is there really any challenge? Let us discuss some point about government OPD. As I am working in Delhi government OPD for 15 years, I can share my thought. When this topic was decided and I talked to my friends, one of my friends told me, I am wondering where are the challenges? Why do you think there are challenges in government OPD? Because in government service, you can sit there in OPD, patient would come, you would check and give some medicine. You are not responsible for whether the patient gets cured or gets better or comes again with another patient person. There is no responsibility. Why are you so worried like private practice and why do you think that there are some challenges? I think there are no challenges. So challenges are there only when a doctor sitting in government OPD thinks that patient satisfaction is necessary. And if we think it is our responsibility to give something back to homeopathy, as homeopathy has given us a respectable position and decent life. And this is the best scope to spread the message that homeopathy is effective. Shouldn't we spread some positive thing about homeopathy? So, from this perspective, I took this as a challenge even when I am working in a government OPD. So, being in government job is not 100% flower. There are fire also. Posting far from residence, whereas others are in nearby posted, getting insufficient or non-cooperative subordinate, or some unsuitable administration may be sore point. So sometimes we have soreness mentally, and obviously there may be problem in personal level, both mentally and physically. But as we decided to accept challenge, for that cause we need to be healthy mentally and physically. Because when we are balanced, our indwelling, reason gifted mind can freely employ this living, healthy instrument for the higher purpose of our existence. A doctor needs to be healthy both physically and mentally. Hahnemann emphasized that the doctor should have sound senses, should be an unprejudiced observer with untiring zeal. So, meditation, exercise, diet, positive thinking are not only for patient. Firstly, this is for doctor. The more a doctor healthy and poised, the more he is capable. I want to mention here a little association with our respected sir, Dr. R.R. Jawardar. He was teacher of many teachers and respected by everybody around him. A young girl of around 19 was in OPD when Sir was taking her case. She was not answering clearly. Her mother was by her side and she was answering the questions. At a point of time, Sir got irritated and used some harsh word to the patients. However, when OPD was over and I was accompanying him to main gate, he told, Abishes, don't do this type of behavior with patient. I am old and not well, but you are young and starting your career. Remember this. Be polite with patient always. Challenges in daily OPD. In the beginning, administrative setup was totally unknown. How to write letter to authority, how to tackle non-obeying subordinates, how to tackle local Neta-like person who demand fake medical certificates, how to procure medicine from central store, how to make monthly reports, and etc. Language, food, culture, people around me, society setup, all were different. In my early dispensary days as a MO, a patient asked me, मैं घुटनों में पोखरे का तेल लगा सकता हूँ? Can I apply पोखरे का तेल on my knee? So I was not aware about पोखरे का तेल. Later I found it was simply coconut oil. So this was something which need to be adjusted during primary life, primary days of my MO. As language and society setup was different, I could not tell a person suffering from cold कि एक तो तुलसी मधु खाइए देवे. I cannot tell a patient suffered from viral fever and now weak कि एक तो पातला करे झोल खाओगे. So we had to adapt what's food society setup of Delhi and acted accordingly. Moreover, as medical officer or teaching faculty or administrator or store officer, whoever are in government post, some works which are not directly related to patient are necessary. But we should take it as a challenge and always need to balance between these works of government works which are necessary works and with our OPD and patient satisfaction. In this picture, you can see one. Uh, this one. This is a conceptualized and led by our director sir of Directorate of Health, Directorate of Delhi, Directorate of Ayush, Delhi government. This was conceptualized and led by our director sir, Dr. R.K. Manchanda, and encouraged and supported by our deputy director sir, Brenda Sharma. Like many GDMOs, I am privileged to be small part of this. So these are essential work which are need to be done, but at the same time, we should take it as a challenge to balance between patient care and other works. So challenge 3, when we are mentally, physically fit, accepted challenge to reach homeopathy to all level of persons and sitting in OPD with open mind to treat patient and give effects as soon as much as possible. Some non-serious patients comes in government facility. These are those patients who just come to eat your head as the facility is free. They are not in mood to continue treatment. An example from court complex dispensary. Suppose a lawyer or someone related to legal case has his listing after 3 hours. So he is free for 3 hours, roams around, and when he sees there is a free facility, he thinks of collecting some free things. Even though I can understand, I can't ignore, as the person is in fault finding mood. So he may create ruckus, and this creates irritation. which affect a genuine person who is waiting next. What to do? To make some opportunities out of it. I try to prescribe medicine which I generally do not use, but read somewhere or learn from somewhere as effective for that condition. As you know, clinical verification gives experience, and that makes us more perfect. And secondly, I always think this is a task to improve my temperament, to be cool even with irritating situation. Challenge 4. Referred patient and chronic cases. This type of patients sometimes comes with lots of investigations. They demand time and attention. You have to go through different reports which are sometimes in a disorganized way. The challenge is they want to get result from homeopathy and they did not get hope till now from conventional system. At the same time, opportunity lies in those cases as different investigations were done in this process, so we can easily understand the progress of pathology and can find out what we can do in those cases and if somehow we can give result in those cases. I remember a case of bronchial asthma. The boy aged about 7 years was on allopathic treatment. Steroid has been given and along with that he used to use asthalin pump every day several times a day. It was 2009. Parents were very much worried about living his normal life. During case taking, I found a peculiar thing. The boy would prefer knee elbow position whenever he got dyspnea, as that was the only position he would get relief. Metronome was prescribed, and after several visits and after several ups and downs, patients started getting relief. Allopathic medication withdrawn gradually. Only asthalin pump was allowed to take whenever he gets too much of breathlessness. For several years, the patient continued treatment whenever necessary. Sometimes the condition aggravated, but overall he was better and had to look to Castellin pump in rare occasions. In last 12 years, wherever I was posted, they collected address and list to my new posting to report whenever required. Last month, in August 22, he reached out to me to inform that he is going out of Delhi for study and reported that he rarely gets asthmatic attack and in very few occasions he had to take Estelin pump. This good result has given me a group of people who took treatment from me and ultimately the challenge became opportunity and it was really rewarding. Challenge 5. One-sided disease with too little information. You can see a screenshot where a patient, a person known to me, has sent this only a picture. सर ये मेरे भाई के बेटे का मसला है कोई ऐसी दवाई बताइए जिसमें ठीक हो जाए so you do not have much information many times, but you have to take those symptoms only because patient was not in my reach and he was not even interested to tell symptoms which I require. Only I found in repertory skin was small, skin was smooth, and extremities were hand. Only on these three small symptoms, more small rubric, I prescribed Dalkamara, and it was uh, it was rewarding that the patient get better within few days. Or for example, a case of migraine. A case of migraine was traveling patient for 10 years. Symptoms were too less. After much query and observation, it was found that the headache was appearing in alternate side every spell. She was relieved by Lacarina. She is still in touch and happy with homeopathy. I am not boasting my success, and this type of success is not only limited to any person or me. Many of our seniors, colleagues, and juniors are treating many cases successfully. We need to mention this repeatedly to keep ourselves motivated. Sometimes we do not get desired result even after sincerely working on the case. Nothing is 100%. We all come to the field with some basic knowledge. With passage of time, we gain experience and skill, and it varies from person to person, depending upon exposure, guidance, attitude, and life situation. Keeping ourselves motivated and urge of upgradation is challenging as well as rewarding when it satisfies patients. Challenge 6. Acute cases. Since appearance of COVID-19, fever and sore throat has become a big concern to patients. This is an example of such case. 2 weeks back, senior public prosecutor of court came to our OPD for sore throat. His friend, a lawyer, accompanied him as he got better by homeopathy. He had sore throat, sticking pain in throat, aggravated by cold things and wind, was uncomfortable in AC room and ameliorated by sipping warm water and tea. He has taken some home medicine for 2 3 days, not relieved, then azithromycin for 5 days, not relieved, and then his friend suggested him to take homeopathic medicine. He started taking homeopathic medicine, and in next visit, he was too happy to report that in 2 days he got maximum relief. You can assume the medicine. It was Iqbal. Challenge 7. Lifestyle disorder or inappropriately named chronic disorders. Hahnemann, in his Organon, Aphorism 77, have vividly described these as inappropriately chronic disease, which are a result of uh, confined dwellings, deprivation of exercise, overtaxation of mind or body, constant worry, etc. And in today's life, lifestyle disorder is a big issue. There are various such diseases which we encounter in our surroundings. We frequently face questions about various lifestyle disorders where patients are on allopathic medication for lifelong and want to get rid through homeopathy. We should remember that these are product of bad lifestyle, and we can improve cases only with changes in lifestyle. And for this, regular monitoring and multidisciplinary approach is necessary. If we can take up challenges, homeopathy has good scope in this field. But we should not take this as a one disciplinary work. Keeping people in proper diet and exercise and meditation is not easy and not a one time affair that during the visit you only tell patients that you have to do this and this, and people will do regular. No, regular monitoring with multidisciplinary people, a group of people or a team should work in this, and then only this type of disease can be controlled by homeopathy, and this may prove as very much promising scope in our system. So, challenge 8, examination of patient diet and management. These three things, though very important, but frequently missed out by many doctors, even the starting of their career, mid of their career, or even late at their career. Many times we are so engrossed in selection of medicine, whether we have to do single medicine practice or miasmatic or multiple or protocol, etc. We are so engrossed that we forget to even examine the patient. A patient of sore throat, or patient of earache, a patient of pain abdomen, even we do not touch the patient. This is very much necessary. We have, I have learned from many of our teachers and even practically from many persons that touch of doctor to the patient is necessary, and sometimes we are so engrossed that we forget this one. Advice for diet and management is one. Another important point which we forget frequently. If in a case of hemorrhoid, diet is not advised to avoid constipation, even best selected remedies wouldn't work. Case of low back pain or frozen shoulder or spondylosis, arthritis could not be relieved without advice for posture training or proper exercise. Especially in lifestyle disorders, we must know diet and exercise for every set of disease. After doing a short physiotherapy course, I found that many people do wrong exercise. Nowadays, many patients comes with knowledge of diet, exercise, disease, as these are easily available in internet. So we should acquire more knowledge to satisfy them. This is an important challenge to divide patients in group as per their complaint and requirement. Some comes for add-on relief, some are for instant relief, some are for remove from root. Separate approach and separate skill set is needed for separate group. And we should develop this skill to get involved into it and get success out of it. A healthier lifestyle with proper food and exercise along with medicine is necessary in many cases to get desired results. Let me conclude with some take home message. Number one, positive mindset or attitude is key. We should accept our situation and act accordingly. Homeopathy works. This message should spread to all levels of population. We should work towards building our skill set for each group of case. We, as government doctors, should realize our responsibility and work towards patient satisfaction and need to spread the message that homeopathy is effective in all levels of society. At the same time, we should motivate ourselves as well as next generation to accept and act as per situation. Positive attitude changes everything. Let me end with a small poem from Tagore. সংকোচেরও বিহবলতা নিজেরও অপমান সংকটেরই কল্পনাতে হয়ে না ম্রিয়মাণ মুক্ত করো ভয় আপনা মাঝে শক্তি ধরো নিজের করো জয় মুক্ত করো ভয় নিজের পরে করিতে ভর না রেখো সংশয় মুক্ত করো ভয় দুরূহ কাজে নিজেরই দিও কঠিন পরিচয় আপনা মাঝে শক্তি ধরো নিজের করো জয় থ্যাংক ইউ এভরিওয়ান
Thank you, Dr. Saha, for your brilliant presentation. Dr. Saha's presentation puts us in a very humble and straightforward way to the day-to-day problems that we face. Not only that we face, not in Delhi. That is also our problem too. That we face in our OPD in day-to-day practice. And his solution that he showed in the conclusion is simple and very perfect. Thank you, Dr. Shah, for enlightening us, putting us forward, and concluding your session with holding up the positive attitude and holding upright the principles of homeopathy. That is the key to success in even in critical scenarios, more critical scenarios that might have been that is not even presented in the presentations. In more difficult scenarios also, we will be out of it with our positive attitude and our keeping upright the principles of homeopathy and getting more knowledgeable. Thank you, Dr. Shah. Thanks again. Now, uh, we are here at the end of two sessions, and we have got some questions from the audience, and I would like to refer the first question.
Dr.
First
Shomo,
question.
sorry to interrupt. Dr.
Yeah.
Shomo, sorry to interrupt. The first question
Yeah.
opportunity will go to the winner of the quiz. They are on the screen now.
Okay. Okay. Sorry. Sorry for that.
that
Yeah.
now this is the
Winner
question
for
which
the
I had
quiz.
sent you is from the yeah winners of the quiz. Orko, are the winners on screen now?
Good evening, sir. Thank you
Good
for
evening.
giving me an opportunity. Sir, currently I am pursuing my internship in Northeastern Institute of Ayurveda and Homeopathy. I am doing my internship. Sir, my question is, what is the role of 12 tissue remedies in the treatment of complications of diabetes mellitus?
Yeah. Thank you, Dr. Shivani. That's a very nice question. Like the homeopathic remedies, unlike the homeopathic remedies, the tissue remedy concept a bit different. The concept of remedies principally depend upon the theory of deficiencies. And as far as Dr. Susler is concerned and other authors after him, they have put forward the remedy natrum sal as the principal remedy for diabetes. More work in this field, but the exact dosage levels, but accordingly, these tissue remedies may be prescribed on the principles on what Susler prescribed and on the indications which later came up from the detailed proving of remedies. Regarding that, the scope is other remedies, but then again, search over the different repertories and homeopathic literatures, the remedy natrum sal will frequently come up. But if you are using tissue remedies on the exact which Susler used, then the scope is different because
Hmm.
am I audible?
Uh,
Yes, you are now audible.
mm,
Am I audible? Okay. Which is
yes.
typically not the theory which homeopathy stands for which homeopathy stands. For more regarding this matter, if you'd ask Dr. Pulakendu this, I'd refer this question again to Dr. Pulakendu.
No, actually, Dr. Bhattacharya,
Dr.
Somoda,
Pulakendu, if you
yes.
want to add something.
Uh, no, actually, what you are telling, is true, and sometimes it may be needed, but primarily our approach should be for curing the patient, not for substitute or uh, deficiency, not for the deficiency concern. Hello.
Sir, yeah.
Okay.
Sir, I have another
Thank you, Dr.
question.
Pulakendu.
Uh,
And Dr. Datta. Yeah. Yeah.
Sir, I have another question. Can I ask?
What is your next question?
Sir, like if there's a positive family history in a child that in the family there are diabetes mellitus, then can we prevent the occurrence of diabetes mellitus in that child by a homeopathic approach?
I would refer again this question to Dr. our speaker, Dr. Pulakendu. I will again
Actually, it
refer
is.
this question to Dr. Pulakendu.
Actually, it is not applicable only for diabetes, but it
Yes.
may be applicable for any kind of diseases or especially chronic diseases. And during pregnancy, we prescribe sulfur for curing advance or preventive for preventive purpose also. But after birth, uh, actually if we think about this in the line of miasm, we can prevent after anti-miasmatic treatment by anti-miasmatic treatment the recurrence or prevalence of the disease, not specifically for diabetes or asthma like that. Our approach should be to correct his miasmatic uh, deficiencies or cleavage like that.
Thank you, sir. Thank you, sir.
Thank you. And next winner, please, Orko, on screen. Let's have the next winner on screen.
She is absent.
Okay. Now
Okay.
over to moderator for the live chat question.
Yeah. Thank you, Dr. Mukherjee. So, two questions came up from Dr. Probir Mojumdar. Regarding the first question, what are the roles of homeopathic treatment after failing oral hypoglycemic drugs or insulin injections? Regarding this, again, I would like to refer this question to our speaker, Dr. Pulakendu.
Thank you, Somoda. Uh,
Dr. Pulakendu?
actually, I
Yeah.
thank you. Uh, Actually, the first question is what are the roles of homeopathic treatment after failing oral hypoglycemic drug, insulin injection? I have a request to think this matter not in a cross-sectional way, think it is a longitudinal way. That means those patients now in the treatment are failing in injection insulin or oral hypoglycemic drug. Their derangement started few years back, and one time he was a good person, in a good health. After that, deranged primarily in a pre-diabetic condition, or after that he became diabetic and they started according to Harrison's internal medicine. Uh, they started with oral hypoglycemic single medicine. After that, they add another composition. Like that, finally they reach to the insulin injection. So now he is failing oral hypoglycemic or oral insulin injection. That it doesn't mean that his treatment procedure is ended. Actually, he is now under this oral hypoglycemic along with this insulin injections, and diabetic blood sugar level is not under control. That means not below 200. In that situation also, I have a request to use similar medicine but in a palliative manner, as because from this situation we can assess the curability of the patient is less, very less. It is not true that susceptibility or curability is for only homeopaths and not for other system of medicine. It is applicable for all system of medicine. That means patient as a whole is curable or not curable. When he is incurable in a sense of crude medicine, how he become a curable patient in a sense of dynamic medicine? My request is to treat these or manage these patient, not directly stop insulin or oral hypoglycemic drug. 100 years back, if we see Dr. Roberts and Dr. Ellis Barker, like the physician, they drastically told that stop the insulin, then come to me and I will treat. But it was the preliminary era of injection insulin. Today's scenario is quite different from 100 years scenario of 100 years back. In today's scenario, we should continue with this insulin and oral hypoglycemic drug with our medicine we can start with. Then, if some response from the patient occurs, then we can taper the medicines accordingly with the advice of that physician, not our advice, as because we are not the authority of that medicine, prescribing this medicine. Thank you.
Thank you, Dr. Pulakendu. Regarding the first question, I would like to add a few things. Yeah, yeah, our inaugurator wants to say a few words. I will refer to him.
Yes, sir. Please, can you give me some minutes
Dr.
to
Dar.
say something about diabetes?
Yeah. Dr. Dar. or probably
Basically,
split
basically,
emotions.
it's a personal experience about the diabetes. In July 2020, I was first time diagnosed as diabetes, type 2 diabetes with 300 fasting blood sugar and 10.5 HbA1c. It has come like a shock to me because I was never expecting it will happen to me, as I was very good, but it happened. So first of all, I just consulted a physician specialist in my hospital. He told me that you have to go on the insulin because it's very high and complications can be there. But I resisted that insulin intake. Instead, I just started on my diet, just changing my lifestyle, which is very much prominent for the, which is needed for the diabetes type 2 in this treatment. Along with that, I had my constitutional remedy as natromure, which I had took previously when I had a sinusitis, chronic sinusitis, which was there for 10 years. And after joining homeopathy, I took that medicine and I got rid of my sinusitis. That was diagnosed by one of my teachers for me as a constitutional. Once again, I took natromune along with all the dietary restrictions and lifestyle changes. And you will not believe, even I don't believe on myself that within 3 months, the HbA1c level was to 7, and my fasting sugar was maintaining between 100 and 120. Now it's a matter of 2 years now, 2 plus years, that I am maintaining my HbA1c below 6. My fasting sugar is hardly 100, and you will not believe that I am taking all the diet as per the routine. But one thing is that I have taken care of myself. I'm doing continuously morning walk for 6 kilometers in the morning, and some limitation to my diet, along with all the other precautions. So in this regard, I want to add that conscious remedies definitely do wonders. Even they can save you from taking this anti sorry these hyperglycemic drugs like this metformin or glimepiride or any of these allopathic drugs that are used for getting blood sugar level down. But one thing that the new scenario about diabetes that has emerged out, that previously it was thought that it's not reversible. Now the thinking has changed, the scenario has changed. It is definitely reversible, and I'm a living example before you. And the homeopathy can definitely help us out in taking such as by making life of the patient comfortable. And I may say one thing, that now I am 40 plus, and you will not believe that I feel myself as 20 plus, and there's a feel good factor within me after taking homeopathy medicine, that I am good. Might be my test might be off and on here and there, but I am good, I am healthy. So that's the message I want to convey to everybody, that diabetes was thought to be incurable, but it is curable definitely. When the homeopathic intervention can be made, we can get rid of this disease and we can live healthy. Thank you.
Thank you, Dr. Dar,
Okay.
for sharing your positive experience. Thank you.
Dr. Dar, I think
But
in my first example, first case, I think a similar case was like you. Thank you.
That's what I am saying, sir. I'm adding to your
yeah,
adding to
yeah,
your
yeah, yeah,
this classic presentation. Adding to your classic
yeah, yeah,
presentation,
yeah,
adding to the positivity of the patient.
yeah, yeah,
Positivity. You have to have the positivity that helps to your patient.
yeah, yeah.
Yes.
Thank you.
Thank you, sir.
Thank you. That will help us
Excellent.
confide more on our homeopathy, definitely.
Thank you, sir.
Regarding the first question, what Dr. Pulakendu said, I just wanted to add a line or two. That is that uh, role of oral hypoglycemic treatment and insulin. Actually, the modern medicine world in today is advancing a little bit more than just controlling the level of blood sugar. A controlled blood sugar level by giving insulin or oral hypoglycemic agent in 10 to 20 years time results in the same number of cardiac cardiovascular disease and kidney disease than it would have been without these treatments. Few studies are there which showed that the objective of diabetes treatment of diabetes is not only to keep your blood sugar within the specified range, but we have to take care of the macro and microvascular complications of diabetes, which is usually which has usually started perhaps 7, 8 or 10 years, even 10 years before the person was first diagnosed as a diabetes. And failing oral hypoglycemic or insulin injection, from this perspective might be say we might say that it will be almost universal that these things will fail at one time. In somebody, it will fail after 10 years. In somebody, it will fail after 20 to 30 years. Whereas within these two patients in whom it failed 10 years back is perhaps in a very bad situation of health and vitality and related to complications than the patient in whom this occurred after 20 years of treatment. And both of these scenarios perhaps also limits the curability of diabetes. I am not saying that in these scenarios homeopathic medicine will not act, we will not see any diminution in blood sugar level or improvement in the complications by homeopathic medicine. But such occurrences do limit the curability, the prognosis of such cases. We have to aware of that, and we have to make people aware about the thing that from the diagnosis till the complications, homeopathy is able to address it as good as it is able to address all other diseases, even some incurable diseases. Diabetes is also called one of the incurable diseases, but at least if we keep our principles upright, our knowledge of Materia Medica upright, and we follow the line what is showed in the organon and later the followers of Hahnemann, at least there is a bit promise which is better than what is given today by the modern medicine. Many portion of it is my personal opinion, and you may object it, but I thought I should share it with you. Thank you. Regarding the second question, which is what are the roles of homeopathic batch flower remedies in specific types of diabetes? Now, I have a slight objection regarding terminologies in this question. There cannot be any homeopathic batch flower remedies. It is either homeopathic remedy or a batch flower remedy. Then again, the philosophies these two systems follow, batch flower remedies may came up in the hand of a famous homeopath, but the direction of using it without considering does not consider the teachings of organon. Homeopathy can be done following the teachings of organon. Batch flower remedy, regarding batch flower remedy, it is different. It does not follow organon. So you cannot tell that homeopathic batch flower remedy. I know, although in the market batch flower essence is sold in 30 potencies, but where is the proving? Where is the proving? Batch flower remedy as far as I'm aware, certain mental centers like a predominant feeling in the mind, and they may be applied as a complex mixture, like your rescue remedy, which is a famous batch flower remedy running in the market and is a complex remedy. By no way it is homeopathic. And regarding the specific type of diabetes, I fail to understand what is intended by the um, question. What is intended by the question? Specific type of diabetes. What he intends? Is it that specific type of
একটা
diabetes
সেমিনার
that
আছে, একটু কাইন্ডলি
comes
সাইলেন্ট
up from
থাকবেন
certain type of
বা কালকে করতে পারেন।
exposure to certain type of emotion? Okay, and scope of batch flower remedy is perhaps beyond the scope of today's topics. Whether they work or
Right.
not, how they should be applied, this is beyond the scope of today's seminar because we are discussing homeopathic approach to diabetes. Thank you and sorry.
Right.
Another question came up which is related to uh, good evening Dr. Prolay Sharma sir. আশা করি ভালো আছেন। অনেকদিন
গুড
পরে
ইভিনিং স্যার।
দেখলাম আপনাকে।
স্যার নমস্কার।
আশা করি ভালো আছেন। গুড ইভিনিং। গুড ইভিনিং ফর জয়নিং স্যার। আগামী
Good
দিনেও আশা
evening.
করি দেখা হবে। সেকেন্ড কোয়েশ্চেন নাও কামিং আপ টু দ্য সেকেন্ড which came up from Ayush Astana. What is the mental rubrics and their metaphorical meaning when you don't have any teacher to teach you? I would like to refer this question directly to Dr. Saha, who is more able in this matter to speak about this.
Thank you very much. This is an opportunity to tell again about our respected Dr. Jordar sir. When I was completing my internship and going home, I met Dr. Jordar sir and asked him, sir, if I face any problem during my practice, what should I do? He answered in a question. He asked me, when Jordar face any trouble, what Jordar do? No, I do not know, sir. You can tell better. So he said, when Jordar fails or Jordar face trouble, he referred to books. This is your answer. So I like to tell Ayush Asthana that when teacher is not around, books are the best teacher. So this is available in Amazon, Perceiving Rubrics of the Mind by Dr. Farooq J. Master. You can refer this book. This is a good book. And another source, I do not know you are nearby NIH or not. We were in repertory department. I have done repertory, MD in repertory from NIH. And Dr. Pradhan sir was head of the department that time. Uh, we as repertory students have made all mental rubric given detail in our thesis. Our thesis was on mental rubrics only, and he has given portion by portion to a repertory PG. Do this portion, you do that portion, you do third portion. So from the very beginning of mental rubric up to the last rubric, we have done thesis on mental rubric only. So if you can go to the NIH library and collect those, every mental rubric is detailed in the thesis. So this would be a big thing and big source. But if you are not able to reach, always as a short and as good perceiving rubrics of the mind by Dr. Farooq J. Master, you can avail it. It is available in Amazon. Thank you.
Thank you, Dr. Saha, for answering the question. At the end of, we perhaps reached the conclusion of today's session. On behalf of,
Before
on my
before
on my
ending, I
behalf,
want
I
to
would like to thank Bidyut, Dr. Kalyani sir, Dr. Kalyani sir, for putting their endeavors to arrange such CMEs regularly, and which which indeed updates our knowledge every week. Which indeed updates our knowledge every week. I hope join in such CMEs in future too. What do you say? I enjoyed the session very much. Both of the speakers, both of they spoke brilliantly
Some
about
co-
practical
some
aspects of
comments from Dr. Kollani.
those problems with which we
Yeah,
started today.
Kalyani sir will be
Kollani sir, some comments, please.
right,
Kalyani
right.
sir,
Thank you,
if you
Dr.
kindly
Somo.
comment regarding something
Kalyani sir
about
will
today's topic.
compile at the end. But before we request Dr. Kalyani, we'd like to thank the speakers, the moderator, and the inaugurator. I'll request Dr. Pralay to be one of the major lead roles was going to conduct the alumni meet on 9th December. So over to Pralay to give a brief plan about the alumni meet. And at the end, Kalyani sir will give his views, and we all, every say CME, we are eager to listen to Dr. Kalyani sir's valuable inputs. First, Dr. Pralay.
Thank you so much, Dr. Bidyut. It was a lovely evening, but I could not join in time because my mother is sick. Still, I'm in a night. And to talk about the reunion, it gives me immense pleasure, in fact, to welcome all the ex-students of the institution. And as you all know, some of the ex-students are working in this institution, and this maybe in the line of medical faculty or maybe in the teaching faculty. All each and every one alumnus who are working in the NI are eagerly waiting that uh, the ex-students who have completed their course, either DIP NI or MD or BHMS, will join together in their homeland National Institute of Homeopathy on 9th of December 2022. And I believe that there is a good response. In fact, every day we are getting a phone call, and many of us are coming in the institution and asking about the reunion, how it will be conducted. And we do have a response, huge response from every corner of the country. We got response from the MD students. We got the response from the DPNI students. We are getting a huge response from the BHMS students. And I believe this will be the one day get together at National Institute of Homeopathy. I'll request on behalf of the Alumni Association to join this event and to meet with each other. Not only you will meet your batchmate, you will meet your senior, your juniors, and you will see that how the institution look like at present. And you will also meet with your faculty, those who are ex-students, those who are not ex-students, but they are your faculty members, they are teachers. So they will be enjoying together in one day. And in one day program, we do have kind of the discussion, kind of the seminar, kind of get together in the lunch area. And in the evening, we'll definitely have the cultural program. We'll have breakfast together, we'll have lunch together, we'll have dinner together. And that will be the one day stage. And our director has requested us, all the alumni, to be on the 10th of December because 10th of December is our foundation day of the institution. There will be a gala program in that day. So we all together can join the program on 10th of December 2022, joining the foundation day too. So in fact, we are conducting for one day, but the program will be extended second day, in fact. So we all can join there. And to join this event, we have given the link in the WhatsApp group of the alumni association. I believe that everyone got this. Everyone have that sense that how to get touch with this link and how to become a member, how to participate in the event. So with this belief that the the alumnus who are listening right now will be listening later on through the YouTube. This is earnest request and warm welcome to all of the students to be on 9th of December in the institute campus. That is on behalf of the Alumni Association. This is my honest request to all of you. Thank you so much. I would like to thank Dr. Javeed. I can see Dr. Abishes, Dr. Soumya, Dr. Pulakendu, and yeah, I have covered everyone, I believe. And Kalyani sir, and of course Dr. Bidyut Mukherjee. Thank you so much. Thank you so much.
It's so nice of you, Dr. Pralay, and over to the person whom we all
Thank you.
eager to listen to, our president, Dr. Kalyani sir. Sir, unmute করুন, sir. Sir, unmute করুন, please.
Just a minute. Mic is muted. Tutor,
Yeah, now
টেস্ট
it's
মাইকটা আনমিউটেড হচ্ছে। Am I
sir
audible
এখন
now?
শোনা যাচ্ছে? Yes sir, we can listen to you.
আচ্ছা, there is some problem I think in my mobile. না ঠিক আছে, এটা মিউট হয়ে গেছিল। Audible now?
Yes
Hello?
sir.
Yes, sir. Yes, sir. Yes, sir.
আচ্ছা,
You are audible.
very sorry. Anyway, we are really thankful to our inaugurator, moderator, speaker. To be very frank, today's seminar is a really brilliant seminar. Every one of us has learned something, and we have learned how to gain confidence, how to build up our careers. We are crying for our careers. Many of us are not satisfied, but we did not have the basic qualities as Dr. Saha has nicely explained, nicely, point by point. I just want to recall my teachers regarding this CME information we got. First, let me add a little bit. Dr. M.M. Datta, many of you might be knowing him. He used to come in NIH too. When we were in Calcutta Homoeopathy Medical College, from the first year itself, from the first day, very first day, he used to call all the first year students and all the students of all the years as either Saheb or Doctor. Means, কেমন আছো সাহেব? Doctor কেমন আছো? From the very first year, from the very beginning. So on the third year, one day I got this chance when I became close to Dr. Datta, and I asked him, sir, from first year and to all the first year students from very beginning, first day, why you are calling all of us as Doctor or Sahib? His reply was, I just want to remind you that you are not an ordinary person of the society. You are first class citizen. You must develop that quality to be first class with all the qualities a human beings can have. So that stuck to my mind that we are not only legally first class 1 citizens of the nation, we are having serious responsibilities regarding society, health of the society, personal health, and many other regards, including judicial system. So the information we collected from Dr. Shah is really brilliant, and we must try to follow each and every one point by point. As I heard from him, rare cases I heard it, that mental concentration is such a very brilliant thing you cannot be able to realize until you practice it. If you cannot make your mind quiet, if you do not learn to concentrate on a particular subject, how we will be able to concentrate on a patient's unrevealed information if we are not concentrated by practicing mental concentration. So mental concentration, physical health, mental health is very, very necessary for all the physicians. It's a very brilliant information that first physician should be fit in all regards. Then he will think to make other patients fit. So thank you, brilliant CME. Many thanks to Dr. Abishes Saha. Now a little bit add to regarding diabetes. I will give you some information that one day with one of my relatives, I went to SSKM hospital with the complaints that palpitation, other cardiac complaints, seems to be cardiac complaints are not getting relief by multiple treatments. He was even treated in NIH by the consultant also, but no relief. But I found Dr. Moni Chetri, you might have heard his name. He was such a person, he was given best credit by the government of West Bengal. Till his last day, he was kept in SSKM or PG hospital campus with utmost care by the government of West Bengal. So one day, I got an appointment through some sources, and when I went to his department, there was none. One person came with an ordinary pen, white pant and half shirt, and he was arranging the table materials, means paperweight, papers. They kept it nicely. I asked him when Dr. Chetri will come. Then he told, wait, he will come. Very short person, very emaciated, means thin and short person. You wait, he will be coming. We are waiting. Like, number of students, postgraduate students with file and khatas, they entered in the room. When that seems to be attendant entered behind that outside room. Then after some time, as per seriality, my patient was called. I entered his room and I found that there is a very big room. with a revolving chair on a dais, circular table, very big circular table, number of multiple costly chairs, but that attendant, no doctor is there in the chair. But all the students, boys and girls, postgraduate students, they are encircled, but they have encircled one person to whom I thought is an attendant of the department. He's sitting on a tool, you know, that stainless revolving tool kept for the patient by three-headed posture. What is three-headed posture? Knees are folded and flexed to abdomen and head is put between the knees. This was his appearance. We entered, he was in the same posture. One student, after he took the case history outside, he just started telling, sir, a lady of 37 years, non-diabetic, non-hypertensive, complaining of these complaints. He simply, by closing eyes, listen everything, asking only one question: does the patient have palpitation during rest even? The student replied, no, sir. It is not a case of heart. Sent him to other departments. But after that, I came out. I waited. I made that PGT. Then I asked him why he was silent, was in this posture, and your presentation was first by diabetes, non-diabetic, non-hypertensive. The reply was, he'll be such an annoyed, angry if we do not mention these two first before seeing any patients. But I want to tell you, such a big person, such important personnel, such a big doctor, brilliant scholar, how simple he is, how polite, how gentle, and how soft, how particular he is regarding his lifestyle, diagnosis, teaching of the students, and the approach for the patients. So why I want to I mention this, that diabetes is such a disease that the first question or first answer will be, is the patient is diabetic? If yes, you must be very, very serious, because from hair to foot, nails, there is no system or organ which cannot be affected by hyperglycemia. Another information regarding one of my teachers. You might be knowing that the first director of NIH, Dr. K.P. Majumdar, leaving his roaring practice in Bombay, he joined as director of NIH to improve our system. Such dedication, I think such type of dedication you won't find anymore. And what he used to do after coming in Calcutta, after joining NIH, he used to go to different hospitals and meet different heads of departments, just retiring or retired important personnel. He used to tell them, sir, I want to make homeopathic teachers. Can you help me? The brilliant scholars were very much satisfied. They joined in NIH as a guest lecturer. Many of you know their names, Dr. Dr. Mitro, anatomy. Then your Dr. D. Pal from Maheshwar Homeopathy Medical College for Shaman Mitro, anatomy. B.K. Chakraborty from physiology. Then your K.L. Mukherjee, biochemistry. Likewise, all the brilliant scholars used to collect for making teachers, and they were teaching deep NIH students. Many of the deep NIH and many BHM students, they were exposed to their teachings, how brilliant it was. So I will tell you one example of Dr. K.L. Mukherjee, a great biochemist. Such a great they were, the names of Saman Mitro, then your K.L. Mukherjee. Another incident I want to tell you, I cannot just want to mention you that once we are in Bongo Bhavan for ministerial work from NIH, and we were in a room where number of MBBS doctors, they were waiting to sit for postgraduate examination in AIMS. So when we were just discussing, just gossiping, when they came to know that we are exposed, we are the students of Dr. K.L. Mukherjee, Dr. Samar Mitro, Dr. B.K. Mukherjee, and many other stalwarts. Those students told us, really, you are very, very lucky. We all have heard their names. They are nationally famous. Many of them are internationally famous. But unfortunately, we are never exposed to any one of their classes. You are really fortunate that you had 2 years of exposure with those brilliant scholars. Such type of talent they were. So I will tell you regarding diabetes, KL Mukherjee's experience. We are having biochemistry examination, final examination, and we had to face the examination in Institute of Child Health Park Circus. Dr. Chamili Ganguly was our teacher also, biochemistry. So when I entered in the examination hall, examination started in particular time. First boy, second boy, third boy, everyone came out from the room after 10, 15, 20 minutes with weeping or very much depressed, sad. I was called forth. I went in. I was not going, I was not going in because all the brilliant scholars nationally selected, they are weeping, they are depressed so much by biochemistry examination. Then ultimately, KL Mukherjee asked Dr. Chamili Ganguly, where is the next student? Sir, they are coming. Then he came out, madam came out, and then talked to us. We told, madam, three are weeping. So I don't want to get fail. I want to be absent. Then madam, okay, you come. You come inside. No, there will be no problem. We came inside. Dr. Chamili Ganguly started asking questions from chains, biochemistry, bondage, etc., etc. KL Mukherjee was just keeping his both the legs on the table with a book. He was reading the book. When I stopped replying, then Chamili Ganguly started shouting, reply, ask, answer the questions. Then suddenly Dr. KL Mukherjee wake up from his study. He asked, Are Chamili? I am telling in Bengali, please don't mind. Are, তুমি সব কি জিজ্ঞেস করছো? ওরা কি বায়োকেমিস্ট্রি হবে? বায়োকেমিস্ট ওরা ডাক্তার। তোমাকে প্রশ্ন করতে হবে না, তুমি জানলাটা খুলে দাও। Madam went off, opened the window, sat, put his legs down, then asked me, where is your home? I told, Howrah and this and that place. Can you tell me which is famous in your place for eating? So I told that's a pantua, as you called as kalozam. Very nice. I have tasted, really good. আচ্ছা বাবা বলো তো কালো তোমার পান্তুয়া বেশি খেলে কি সমস্যা হতে পারে? তো আই টোল্ড স্যার হাইপারগ্লাইসেমিয়া। হাইপারগ্লাইসেমিয়া হলে তো কি আছে, সুগার ব্লাডে বেশি হলে তার ক্ষতি কি আছে, তাতে কি হয়? মাই রিপ্লাইজ ওয়াজ ketone excess, hyperketemia. Then what happens? What is the problem with the ketemia? Gradually, he started asking questions. I am going on replying. Ultimately, cerebral coma, their complications, etc. Then your KL Mukherjee started shouting, আরে তুমি সব ছেলেগুলোকে ফেল করাছো, ভালো ভালো ছেলে ডাকো আবার from the very first. All were again recalled by the KL Mukherjee. All got good marks and passed with credit. This was the type of teachers, and this was the training of diabetes. What in my experience I am telling, just ask the habitat, the type of diets, the development, as we heard from the speakers today. Another very beautiful thing, you'll be happy to know that Dr. Dipal, all of you know him. Dr. Dipal is such a person wearing chappal, then ordinary pant, half shirt with an umbrella in hands was his appearance. On the first day in the class he came and he told that I will teach you only two diseases. One is the anemia, another is diabetes. First year I will teach you anemia, second year I will teach you diabetes mellitus. Then we were surprised. We have been selected from all over India. This doctor will only teach two drugs in medicine. Anemia and diabetes, there are so many diseases. We did not dare to ask him why. He started teaching anemia with differential diagnosis, completed many, majority of the diseases simply through anemia and completed first year. Our questions were only on anemia and its complications. Second year, a tough year, was only diabetes. All the diabetes, its complications, effects from brain to foot. What I want to tell you, that such a disease, diabetes, it needs to be learned and taught for years, maybe years together. Such a critical disease, such a harmful disease for any and every system, can create any and every disease. Then my first experience in research. When I joined in NIH, at that time there was no research department, no research activities in NIH. Simply the students were there for teaching classes. We are allotted classes to teach. But at the same time, CRH and NIH at that time was working simultaneously in 118 Amma Street, in same building, in same outdoor indoor. We were given one allotment to study on diabetes mellitus by Cephalendra indica mother. By the first day we got the order, we became very irritated. This is homeopathy, in national homeopathy. And by CCR is the biggest unit of the country. Cephalendra indica on diabetes mellitus. Absolutely non-homeopathic. But we are in service. At that time, we were under probationary period. So we were scared of our service. We started working on Cephalendra indica in OPD and IPD diabetes cases. Result was good, but never brilliant. I found, or none of my co-workers found a single case diabetes cured, but a number of cases improved that I have seen. You might be knowing by through chemical activities, chemical actions, Cephalendra indica, gymnema, these medicines can have certain type of works, but it never cures. In later life, when we started working in NIH, Salt Lake campus, we got number of cases on diabetes. While treating other diseases, we got number of cases of diabetes. Specifically, we separately segregated those diseases and tried with constitutional medicine, as we have just learned from this last CME from Dr. Saha. And we got brilliant results. If I get time in near future, I will show more than dozens of cases getting completely cure of diabetes mellitus. If anyone has the doubt that diabetes is an incurable cases, I must tell him, please try rationally, homeopathically, then you conclude. You are bound to change your ideas if you proceed to particular homeopathic cases. Why? Because all the time pancreas is not completely destroyed for all the cases. Many times it can happen that pancreas is partially sick. Islets of Langerhans is not completely destroyed, but non-functioning, less functioning, or partially sick, or there is degenerative changes, not deadly changes like necrosis or other diseases. So by simply by seeing the blood levels, it is difficult to assess the physiological or biochemical actions, activities, and life of the islets of Langerhans and beta cells for glucagon. So unless we start treatment, the case is called to be incurable. We never called as incurable unless our parameter sets in. Until we get 12 observation, the observation will be observed for an incurable cases. We cannot claim any cases, whatever incurable called for is truly incurable. Definitely we should try our level best to see whether case is really incurable or it is curable. There is hopes. So please do not tell any patient that you are incurable. As I told frequently, tell the patient you are suffering from a disease which is difficult to cure. You know that because you are coming from the modern system medicine. I will try my level best. Both of us will be able to conclude whether you are curable or not after a little bit of treatment, at least 2-3 months. If I find that blood level is coming down, you may be curable. If I found the level is not coming down, getting higher up, then you may be incurable. So what is my advice? Should not leave any patient. Take the patient seriously. Approach with case history evaluation and repertoriation. Think for the drug. As today we saw number of cases of diabetes has been cured. I have also seen more than dozens of cases cured in NIH OPD itself. So like other diseases, we should conclude that diabetes is a critical disease, difficult disease, chronic disease, maybe one-sided disease, maybe inherited, whatever may be the factors behind. But until we try, until rationally, homeopathically we start trialing, we cannot conclude whether it is curable or incurable. One of my experience I can share you, as we are talking about insulin resistant diabetes, we got cases. And eventually, suddenly one day, one thing came in my mind, insulin chemically is non-effective, resistance chemically. Can homeopathic potency or potentize form it can help? I tried to purchase insulin 30 and 200 from Hahnemann Publishing Company. I tried to give him insulin resistance cases, and you'll be very happy to know you yourself can try. The cases who are not responding to your constitutional symptom, not getting cure easily, seems to be insulin resistance. At least one try by insulin potentized medications, homeopathically used. Many of the cases I have seen brilliant results. You can also have your experiences. So anyway, lastly, I don't want to extend much more. We are really very happy. We are learning in every CME. This CME was brilliant for all of us. For basic, as we called as fundamental points to become a good doctor, to flourish your practice, to be good in service in every regard. So please keep in mind, see this CME information infrequently when you get depressed. You'll be encouraged and definitely will improve. Thank you very much. Thank you all the participants who are viewing, who will view it later on. Special thank to Dr. Javeed Iqbal Dhar for coming with us after a long, long time. He was very much helpful when we were continuing CME in NIH campus. He was such an helpful that we could not think of any CME in NIH campus without Dr. Javed. Always used to phone him, always we used to disturb him. Javed, where are you? Please come with the key, with this and that, with the laptop, with the. Then he used to arrange everything. But I cannot tell you how much he was helpful for this NIH CME in beginning, which has taken shape of today. Then really brilliant moderation by uh, Dr. Bhattacharya, Soumya Bhattacharya, brilliant moderation. And what should I say? The Deng Supriyo Bhattacharya, sorry, Soumya Bhattacharya for giving very nice information, encouraging and showing the cases. Always we must try to focus our cases to encourage others that this case can be cured. And really special thanks to very busy, very important, very responsible person in post for giving us time to share his really life experience in homeopathic practice in government hospital clinics and private clinics. Thank you very much. Many, many thanks. We are very much encouraged by your presence, participation, and we
Thank you, sir.
expect and we ask all of you to come forward, being prepared for any other subject. Thank you very much. All of us will be encouraged by your
Thank you, sir.
participation. Thank you
Yes,
very
sir.
much.
Thank you
Thank
very
you.
much. Thank you. Thank you all. Thank you, Vidyut. Good night.
Thank you all.
And thank
And Please stay back for the post-CME talks in this platform after we close the live session. And we'll have our next session after the Durga Puja on the day of Lakshmi Puja, 9th of October. And we'll be having a bunch of very experienced as well as young, energetic speaker from Rajasthan and very learned professor will issue the poster by tomorrow, and we'll be keeping this name till now secret, but it's a very learned person who is coming on 9th October to enrich us with a lot of knowledge. And that's all for tonight. We are looking forward to see you all on 9th of October online and 9th of December live physically back to the alma mater at NIH. Now over to Orko, our
Definitely will
backstage
there.
editor.
Definitely will be there. Always.
thank you very much.
That's great.
All of us will be
Thank
happy.
you.
Thank you all.
Everyone. Yes.
Thank you.
Thank you,
Thank
Bidyut.
you.
Thank you. Thank you, Kalyani sir. Good night.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And the thing which I was talking about from the first, let me just tell you this. We since it's a CME we have done after the few issues we were having on IT team, like exams and something. So after that, we have done this program, and it's an achievement. And let me just tell you in brief that we will be uploading on Spotify the highlights from next Sunday onwards. Please stay tuned and go check the link, follow the playlist to get updated, because it's on CME highlights. It will be of good value to you. And one more thing about the certificates, we are trying to resolve the issues and resume the certification process from next CME onwards. I hope it will be not an issue from next time, and we are extremely sorry for that. With this, these were two topics I was about to talk. And one more thing, thanks for watching. Do make sure to like us on Facebook to get updates on NIH Alumni Association. What is happening on NIH Alumni Association, and also updates on CMA schedules, which you will also get on Telegram channel and on Instagram and Twitter too. Do make sure to join the Telegram channel. Link is in the description. And also the quiz part, it will be given over there too. The link for the quiz group, it will be given over there while the CME schedules. And this was it. See you on our next CME. Until then, this is me, Orko Mukherjee, leaving.